But when you have a 12-year-old coding, you're sending an ALS rig.
Yeah.
Also, just load her on up and keep going with your compressions. What are we waiting on?
Do compressions on your way in.
Bag and compressions.
Number one, you're right. They should have said ALS on that call, right? Number two, even if BLS shows up, do CPR and go. Like, what the frick?
We have BLS rigs that show up doing CPR, and boy, are they nervous as hell.
But
they're doing it. They're
doing the basics.
They are. And we're saying, go, baby, go.
Yeah.
Come on in.
Grab a coffee.
Take a breath.
You've just clocked into the ER Edit.
I'm Caitlin.
I'm Carly.
You are now clocked in.
Hello. How was your week?
It was good. Uneventful. The kids are out of school, so
it's almost summertime.
We're just raw dogging it through life around here. There's no schedule going on.
I heard a saying, my kids aren't old enough yet, like with school and everything, but everybody says May is like the second December. Like it's so busy.
It's horrific.
Because everything's coming to an end, school, sports, everything.
Well, everything's done now. But now it's just like camps. It's busy because my kids are at that age too where I kind of have to fill time and they want to do things with their friends.
Which is good. That's what wonderful. You want. Yeah.
So we're like in the thick of it, but it's fun. I love summer. I am one of those moms. Okay, I do enjoy the kids going to school. I'm not even gonna lie. But I also do love summer now that they're to the ages where it feels like we can go out and about and do fun things.
Yeah.
And it's not fully exhausting.
It's not what I'm in right now.
No, I like don't have to pack a stroller. Like, it's just like.
And they can like hang. Yes. Like you can go camping and you can like do things. Well, I know you're not really a camper.
No, but I got what you're saying.
But like
we can take the paddle boards and the kayak to the lake and like the three of us can do that and there's no problem with it, which is great.
The three of us?
Me, Remy, and Indy.
Oh, I was like, what about there's four of you?
No, because Nick is at work. So it's like me cramming time to try and like wear him out throughout the day.
Okay, I follow.
So we're just trying to figure things out. But how was your week?
Good. Just
uneventful,
but so busy.
I know.
Do you know what I mean?
Yeah.
The days are long. What do they say? The days are long, but the years are short.
Isn't that cute? They can suck it when they say that.
I did see a video though the other night because at the end of the day, kids are in bed. I go scroll on TikTok, and I should go to sleep, but I'm up for like 4 hours, and then I'm like crying watching these videos. And I saw this video of this mom saying that her therapist had shared with her that at the end of the day, when you put your kids to bed,
is this gonna make me cry?
That's the last version you're ever gonna see of them again. I know. And like it made me so emotional and I was like, oh my gosh, like, and then I immediately want to get them up and it's like after a long day, you're tired and it's like totally shifts your perspective.
That like really broke my heart right there in that instant.
I know.
You know what? I do see it differently now. Like Remy still. We watch an episode of Bluey, maybe 2, depending on how the night's going, before bed.
Well, they're like 45 seconds long.
Well, they're 7 minutes. So like Nick and I counted on those because we knew what we were getting, right? So sometimes it's 2, but both kids still really enjoy Bluey. I love Bluey.
So good.
It's so good. So we do that every night. But Indy lately has been like, well, you guys watch Bluey. Can I go call Lila, like her bestie? And I'm like, did we reach the point where you're not wanting to come and like sit with us on the couch anymore for our family nighttime?
Yeah.
So there's like some nights where I'm cool and I'm like, yeah, you can go call her. But my heart is like breaking on the inside.
Yeah.
And then there's other nights where I'm like, no, you can sit with the family.
Your ass down.
Like we only get so many of these. You're watching Bluey.
Yeah.
And she's like, what the heck, Mom? But
it is
true. It's like you blink and they're so different. It's so sad. I know. We can end on this, but Nick saw one that stuck with him one time was like, there's going to be a time where you pick your kid up for the last time and not even realize that it was the last time. And that like broke him. He read that in bed one night and I looked over and he's like got tears streaming down his face. But it's heartbreaking.
Well, there was like a trend on TikTok going around of like moms asking it was mostly sons, I feel like, if they could pick them up. And they were clearly like 13, like too old to be held. But it was because of that. Like one day they just realized like, I never picked him up again.
Okay. We need to go.
Okay, we need to stop. We need to stop.
We're going to decompress really quick and then we'll come back. This episode is actually going to be really interesting. I'm excited for this one. We've done a little research on today's episode because we are going to be going over some of the largest medical malpractice lawsuits in the U.S.
This one's really interesting because I think that if you've been a nurse for any period of time, like not every nurse, I have never experienced being like deposed or like being in a deposition. But that's always a thought you have. And when you chart, as you should, you're always thinking of like, if this went to court, how am I protecting myself, the patient, my license, etc. And even though not everybody, has been involved in a lawsuit, like directly or named in a lawsuit, these cases are so interesting because so many people can be attached to somebody's chart who's involved in a lawsuit.
Yes.
And so I think it's like a fear that like we all always have.
Oh, 1,000%. I've been deposed one time and it was terrifying.
Scary.
And it was not even anything to do with me. I started an IV on a patient. That was it. That was how my name.
But you were linked.
But I was linked because I documented the IV that I started on there and I had to go to court. So it's literally, I think people don't understand. They might be like, well, I didn't really have anything to do with the patient. It doesn't matter.
They pull everything.
Yeah. And a lot of these too are multifaceted in the sense that like some of it's negligence. Some of it is just like a miss somehow in the hospital system.
Or medication errors.
Yeah. So all of these different like malpractice suits can be from so many different things that it's like, it's really scary when you read
It is scary,
them.
but it's also very intriguing.
Yeah.
Because the legal world is like, it's so enmeshed in medical, but it's like also such a whole nother world that like, I don't know much about.
Yeah.
And when these big lawsuits happen and there's big lawyers involved and lots of people trying to get lots of money. Yeah.
Exactly. And some of these are mind blowing, truly.
Okay. So in addition to looking up some of these like large cases, we also looked up a lot of statistics and information because I think this is something that you need like facts, cold hard facts.
Well, and it's important. Like at the end of the day, knowing these, I think puts into perspective when you're at work, like the severity of certain things. You know
Totally.
what I mean?
What do you think the largest medical malpractice verdict ever awarded in U.S. history was?
I mean, I feel like it has to be large.
And it's pretty recent.
Oh, really?
That's what I'm finding on the internet.
Okay. I'm going to say 600 million.
The largest medical malpractice verdict in history is a $951 million judgment awarded in August of 2025 by a Utah judge against Steward Healthcare. It was about a newborn who sustained irreversible hypoxic brain damage during delivery.
Okay, so I'm curious to know what was the legality behind that?
What do you
did
mean?
The physician not get the baby out in time?
It tells the case here very brief. The mother endured 36 hours of labor. The nursing staff, who were recently out of training, administered excessive high doses of Pitocin despite clear signs of fetal distress. Meanwhile, the on-call physician was reportedly asleep, and a delayed C-section caused the child to suffer severe lifelong cognitive and physical impairments. Because the hospital's legal team withdrew and the institution failed to participate in litigation, the court issued a default judgment. The judge hit the facility with the $951 million award, citing the severity and preventability of the harm, and called it literally the most dangerous place on the planet for her to have given birth. I don't know about that, but
gosh, I mean, that's so heartbreaking. But that's just one of those things where it's like everything worked out perfectly in the worst way. You know what I mean?
So this is interesting. This next little blurb says, despite the record-breaking number, collecting the full award is highly challenging. The hospital chain, Steward Healthcare, filed for bankruptcy, and the facility was subsequently taken over by Common Spirit Health. Furthermore, state-specific caps, like Utah's $450,000 limit on non-economic damages, can legally reduce what the family ultimately will receive.
Oh. So they're going to get chump change.
Yep.
Oh my God.
This is insane.
I mean, but I think we would hear that a lot, right? Like, of course, anybody that gets a lawsuit with a payout that high are going to do everything they can to save face and go bankrupt.
I think bankruptcy is like the first move.
Yeah.
So myself included, a lot of people don't understand maybe like what all goes into malpractice. I don't either.
Yeah.
And the legal MP would also be really good on this episode.
Well, her book.
Yes.
We should just go get her book and flip through it.
We should just do it like read aloud.
Yeah.
So we were looking up medical malpractice generally requires the following: a doctor-patient relationship, a breach of the standard of care, injury caused by that breach, and measurable damages. So it sounds like those things have to be included.
You have to have all four?
I mean, it sounds like that. It says it generally requires. So maybe not all of them, but maybe like you have to prove that like at least one of those or multiple of those
was present
in the case. And then it asks the question, what do you think is worse? Having a doctor make a mistake or having the hospital know about the mistake, making mistakes that were made and do nothing?
Oh, the hospital. 100%. Any hospital system that's going to brush things under the rug and cover up something, I think is not okay.
Do you think that's
the norm,
though?
Absolutely.
Because it all comes back to dollars, right?
Well, I think it all comes back to legality. I think hospitals are money-making systems, right? They're a business. At the end of the day, it is a business that is being ran, and any business has, in their mind, their goal is to save face so that people keep coming back.
Yeah.
So you start having all of these legal problems and cases with your name on it. That's the worst thing for you. So I think just like any other business, they're going to keep things as much as they can hidden. But at the same time, I think that there's a level of, I don't know, I just like honesty. So I'm like, in my mind, fess up about it. What are you going to do about it to make it better? And I would much rather go to a hospital system like that than a hospital system that I know is sweeping things under the rug.
I think this is twofold though, because I think that these like massive lawsuits, the ones that like we're going to read about, like those obviously have to get reported. Yeah. Like a hospital is not stupid enough where if they have like a sentinel event, that they're not going to report something. Like they have to, right? Even more minor things like not sentinel events, like they have to do internal investigations.
Yes.
But I think that like letting it cross over to the media or get out, they're really good at hiding. But then it's also like these mistakes, whether it be a physician, a nurse, whatever it is, whoever is involved, it's almost like that person fighting the lawsuit and then the hospital system fighting the lawsuit. Because rarely do they like work together.
They don't.
And I know that a lot of people think like, oh, I work for this big healthcare system. Like they got my back. They've got all these big lawyers. No. When these lawsuits come out, it's like everyone's protecting their own ass. So even though you're with them, it's like separate.
I think that's why Jamie is like, so she's the legal MP, like we've talked about. I think that's why she's so adamant on everybody having their own medical malpractice insurance. Yeah. She talks about that all the time.
I mean, they told us that when I was in nursing school.
I know. It's unfortunate though that you never think that you're going to need it until you do. And you do think, I think every nurse or doctor or whoever is naive in the sense that I think all of us, not all of us, a lot of people are innately good that go into this profession. I do believe that, right? There are obviously on last week's episode, we know that there are some that are not, you know, like, but I just think that typically when you go into especially this profession, I think you're kind of thinking of the best things in the sense that you're there to take care of people. You're working for a huge corporation that's going to take care of you. And things are kind of like butterflies and roses until you get in the weeds and you're like, oh, maybe this isn't the case.
Yeah.
So I have a couple cases here that I looked up and they're really sad, like really, really sad. And I won't go into like the ins and outs of all of them. It's pretty like, it's not super detailed.
It's just like Cliff Notes.
Yeah. Which I love. Let me pull it up here. The first one that we had happened in the state of Florida, and it was in...
Everything's in Florida.
I know. It was in 2006. I'll tell you the compensation at the very end. Okay. But Alan Navarro's... Apparently he was a basketball player. Alan Navarro had a doctor that failed to recognize his symptoms of a stroke and misdiagnosed him with a sinus infection. Mm-hmm. He was sent home with painkillers instead. The next day, he needed emergency surgery for brain swelling and stayed in a coma for 3 months. The misdiagnosis left Navarro, a basketball pro, brain damaged and paralyzed. It also resulted in limited cognitive injuries and challenges swallowing food safely.
Oh my God.
It was later discovered that the doctor who performed the initial exam was actually an unlicensed physician assistant. He was represented and won $216.7 million. This to me has so many things to break down.
Well, while you were reading that, I had so many questions come up, like just even in those little Cliff Notes version. Number one, why are you not scanning somebody who's coming in with like symptoms, like neuro symptoms? Like I didn't say what his symptoms were, but to just say you have a sinus infection, like I'm assuming you ruled out the emergencies then.
Also, please tell me what stroke-like symptoms are mimicking a sinus infection.
Second question. How is an unlicensed PA employed by a healthcare system?
Right. So like, that's fraud. There's so many things going on with that.
Do you think it was like unlicensed or like they hadn't renewed their license on time, and so there was like, you know what I mean?
Either way, you're unlicensed.
100%.
Yeah, but do they have...
It wasn't like a poser.
Right,
like maybe
right.
they did have a license, but it had lapsed or something, which that's not an excuse, but like, how does the hospital not know about this?
I don't know.
Who's employing them?
And I don't know that there's any healthcare systems today, really, or at least any that I've worked at, that when someone comes in with neuro symptoms, dismisses it without a CT scan. I mean, we light up anybody and everybody that comes in. It doesn't matter. You're getting a CT scan pretty much majority of the time, unless you're a kid. Like I would say under 18, we're probably a little bit more like hesitant to do it. But
I would almost say that we give too many CT scans.
100% agree with you on that.
And so that surprises me.
This is like one of those incidental findings where who cares? Like if he's coming in for blurred vision or for a headache or things like that, scan his head. This case would have been completely different in my mind. It seems to me as if he had some sort of brain bleed that then he was sent home that got increasingly bigger because that is what happens with bleeds. But what could have happened in the meantime, if this had been caught when he first got there, is he would have had an intervention done by a neurosurgeon.
It probably wouldn't be a lawsuit.
No, it wouldn't have been.
I also just had a thought. What do you think they sent him home with for a sinus infection? Do you think they sent them
painkillers?
Do you think they gave him like Flonase and stuff? Like
probably dilating all that shit. It's terrible. It's so sad. And
so sad.
His whole life is going to be
totally different. And it sounds like he lost his career. Okay, this lawsuit or this next case was it was awarded in 2018 in the state of Michigan. 10-year-old Faith DeGrand was partially paralyzed after a doctor improperly performed surgery at the Children's Hospital of Detroit Medical Center. DeGrand was brought in for scoliosis surgery to prevent the condition from getting worse. Her surgeon placed rods and screws in her spine to help straighten it out, but instead, it compressed her spinal cord and caused numbness in her limbs. By the time her doctor removed the hardware, it was too late to reverse the damage that had been done, and that would affect DeGrand for the rest of her life. It's one of the largest medical malpractice verdicts in the county, and it was in the amount of $135 million.
That's not enough.
For a 10-year-old who now is partially paralyzed?
For a non-life-threatening condition. Like scoliosis isn't, does it make your life very difficult? Does it become, an everyday part of how you function and things like that? I'm sure. But it's not life-threatening. So she went in essentially for a surgery to improve her quality of life. Oh, and came out paralyzed.
So it makes me wonder, and it doesn't say on here, what factors go into determining that dollar amount? Because 135, it's like for a 10-year-old who's now paralyzed.
Well, because typically it would take in like loss of wages. So I'm sure it takes in loss of wages for the parents who now have to be caregivers. It takes in any kind of caregiving. It takes in all of the renovations that have to happen on the house if this kid is like wheelchair bound and needs modifications to the home. But like beyond that, there should be more because you just ruined her life.
Yeah, I mean, it changed her life.
Yeah.
It changed the whole trajectory of her life.
Oh, that's so sad. I don't want there to be any more kids.
It also makes me wonder, like, bringing it back to kind of like our role in healthcare, because obviously we're nurses. So like the first two cases that we've talked about, for example, the stroke-like symptoms that were missed apparently. And then in this case, it sounds like a surgical operation. Mm-hmm. Like, yes, these two specific people, the PA and the surgeon, made mistakes or were dishonest. But there was a whole team of people that worked on that patient, that charted on those patients, that were present during some of these during surgery, during the assessment in the ER. And it makes you wonder, like, what did their charting look like? What were their assessments?
Well, this brings me to the case too, just to kind of like pivot just a little bit. There was just a case that happened in a outpatient surgery center of the lady that was getting the full mommy makeover just recently. And
I don't know if I know this.
So this is about Rachel Tussey. She was a 40-year-old. She was an influencer, had like over 800,000 followers, I think, on TikTok, and was documenting her entire mommy makeover thing. So there's like videos of her in the surgery center before, all of that stuff. Her husband just filed a lawsuit with Journey Light Surgery Center and the Associated Anesthesiologists of Springfield, alleging that his wife died from an opioid overdose administered by nurses following a cosmetic procedure that the facility later altered medical records to conceal the cause of death.
Wait, she died?
Yes. So she died March 17th, 3 weeks after undergoing a tummy tuck and liposuction at the surgery center.
Oh, she didn't die during the procedure.
They gave her 150 micrograms of fentanyl and 1 milligram of Dilaudid within 37 minutes after surgery. According to the 66-page complaint, the post-operative fentanyl dose exceeded the total amount that she was to receive during her entire 9-hour surgery. It says that she was alert and talking with her husband and medical staff when the nurses administered the medication. Minutes later, she became unresponsive, her lips turned blue, and she went into cardiac and respiratory arrest. So
Wait, I thought you
here's
said
where
this was how many days after surgery?
Well, that's what it says up there. I've never read 3 weeks.
So she was in the PACU or recovery.
Well, listen. So this is where it gets shady. The lawsuit states that the anesthesia team and surgeon had already left the facility when she coded.
Oh, no. Anesthesia needs to stay there.
Nurses called 911 at 5:59, which was 9 minutes after she became unresponsive. Emergency medical services arrived at 6:02, which honestly,
3 minutes.
Impressive.
That's really
timing.
good, yeah.
And reached her bedside at 6:04, but she had been without oxygen for more than 6 minutes. They performed CPR in the parking lot, transported her to Bethesda Hospital, and she remained on a ventilator and in intensive care until March 7th when she was transferred to hospice. So
oh my gosh.
Then the lawsuit alleges that Journey Light Surgery Center altered her medical records after her death, changing medication dosages and administration times. The complaint states that the facility administrators asked the surgeon to alter his operative notes, which he refused to do twice. So,
well, good on him for not altering.
All of these people just recently, so like you were talking about, are being charged. There's 11 defendants in this.
Wow.
And so going back to like what you were saying, normally you never really hear of anybody else that's involved in this, or it's normally just like the hospital system and the surgeon,
or like the surgeon, the doctor,
or the anesthesiologist, whatever it may be. This is getting every single person at the surgery center.
Well, that sounds like a lot of people did a lot of shady things.
Yes.
I need to look more into that, because when you were just reading like 150 mics of fentanyl and 1 of Dilaudid, like that to me, working in recovery doesn't sound like a lot. We give pain medicine.
But is there a max amount in surgery that you think of? Like, so that had said like within the 9-hour time frame of her surgery, it reached the max amount.
I don't know what that dose is.
Okay.
Because I think like an anesthesiologist or a CRNA, they would know that, right? And yes, they do get fentanyl intraoperatively sometimes. They do get medications like that. Is there a number? I don't know. I know that in recovery, you usually have like...
Well, you have your PRNs, right?
You have like 25 to 50 mics, right? And you only get like 3 or 4 doses of that, and then it like is gone, right? So it caps you off. I don't know what the total amount in 9 hours like should or shouldn't be. And maybe they had given her a ton intraoperatively.
Right.
I'm not sure. But to give 150 in recovery, especially if she's awake and talking, doesn't seem like that's much.
No, and I think the same thing too for trauma patients. Like giving 150 of fentanyl throughout the course that we go to CT or come back and all
1
of this
Dilaudid.
stuff, that's fine.
Yeah.
Yeah, I've done that multiple times.
So I am curious to know the other details of that.
I know.
And like what did they change their dosing and their times to?
Isn't that so sad?
That's so sad.
So we'll have to continue on with this case too and see what happens, because I'm interested who of the 11 will get convicted and what they'll each get convicted for. Like who's truly at fault.
Well, and it's interesting because I actually worked at an outpatient plastic surgery center for years. And it is different. They do run things very differently than like a hospital.
Yeah, but is your anesthesiologist ever leaving?
There's always an anesthesiologist there until the last patient is discharged.
Gone. Not just in just in recovery.
Like in their car and off the premises.
That's how it should be.
The fact that anesthesia and the surgeons had both left the premises while a patient was still present
and recovering.
That sounds like an issue in and of itself.
Yes. That's strike one. Red flag. Hello.
Yeah.
Okay, the next one we have is a kid. This is a 12-year-old. This was in New York in 2014. 12-year-old Tiffany Applewhite suffered severe brain damage after receiving bad advice from paramedics. Applewhite went into anaphylactic shock after her home nurse gave her a steroid injection to treat an eye infection. Her heart stopped, and Applewhite's mom immediately called 911. EMTs from the New York City Fire Department arrived at her house, but without the equipment necessary to treat her condition. Applewhite's mom wanted to take her daughter to a nearby hospital, but was advised by the EMTs to wait for ALS, advanced life support, ambulances, which took another 25 minutes to arrive. She now requires a feeding tube, a wheelchair, and is unable to speak. This is the largest verdict of its kind in New York City. Her case was originally dismissed because the courts did not think the city should be held liable. However, under New York law, the city can be held liable for personal injuries if a special duty existed when the governmental functions, such as EMTs in this case, were performing their duties. They won $172 million.
I have a couple questions.
Okay, what's yours first? Because I have at least 18.
Okay. So my first question is, this is a young girl.
Mm-hmm.
If she had a simple eye infection, why was there a home health nurse coming to do a steroid injection?
Well,
like, what were her
a little bit more?
Pre-existing
Correct.
Okay. Number two, BLS departments do carry certain medications. They do have epi.
Okay, so my question
she's an anaphylaxis and a BLS department rolls up. Why are they not giving her epi?
She was under CPR, right? When the call went out.
Oh, was she? Did she code?
She was under.
It said they didn't have, it said they were waiting for ALS. So I'm assuming it was a BLS.
It said she went into anaphylactic shock after the steroid injection was given. Her heart stopped.
Oh.
So she was. So my question is when that call went out with a CPR in progress, you're always sending an ALS unit.
Also, BLS can transport. It's BLS.
Yeah.
That's
basic
CPR.
I mean, CPR is basic. But when you have a 12-year-old coding, you're sending an ALS rig.
Yeah.
Also, just load her on up and keep going with your compressions. What are we waiting on?
Do compressions on your way in.
Bag and compressions.
Number one, you're right. They should have sent ALS on that call, right? Number two, even if BLS shows up, do CPR and go. Like, what the frick?
We have BLS rigs that show up doing CPR, and boy, are they nervous as hell. But they're doing it. They're doing it.
But they're doing the basics.
They are. And we're saying, go, baby, go.
Yeah.
Come on in.
Yeah, there's a lot of issues there.
It's really, really sad. And now, again, like the case that you just talked about with the 10-year-old, this is forever changing their entire lives. Mm-hmm. So it's just not enough still for me.
Yeah.
It's never going to be enough.
It's never going to be enough. And I was just going to say that, like, what is enough, you know? Okay, I don't even know anything and I already feel like the dollar amount's too low.
Oh, God. Okay. I didn't look at the dollar.
This was in 2018. Billy Pierce, 61 years old, was misdiagnosed by a doctor on probation and then left under a medically induced coma for over a month until another doctor stepped in, made the correct diagnosis, and successfully performed surgery to remove Pierce's bile duct stones.
What?
The lawsuit was filed against Tyler's East Texas Medical Center, who was found guilty of medical malpractice and gross negligence. The hospital violated their own bylaws by allowing Pierce under the care of Dr. Gary Boyd, who had been placed under probation only a year ago for misdiagnosis and performing unnecessary procedures. During the trial, the hospital's own doctors stood up for their patients, testifying against the hospital and its failure to take action when they knew there was misconduct. And it was in the amount of $43 million.
Oh, yeah, that's not enough at all.
That does not feel like enough.
No.
I'm curious to know, because it said in here that Billy was misdiagnosed and he was in a medical induced coma for over a month. And this is the thing, when you're in a coma for longer than usually 2 weeks max, they don't leave people on vents.
No, they trach you.
They trach you.
Also,
and so I'm like,
a whole team of doctors
working alongside this person.
Right. So how are we misdiagnosing for a whole month?
Also,
nobody caught this?
When you're in the ICU, which you are when you're on a vent like that doctor's not on 24/7.
No, that's what I'm saying.
So you have like another pulmonologist or whoever is the ICU doctor, like overseeing the care.
There's a lot of things that happen. This was a multi-system failure.
Yeah, but I do feel like maybe the more we're talking about this, because you know how it said some of the doctors testified against the hospital.
Yeah.
Maybe there's like a lot more of this to this story.
I have a little story about my own family.
I have one more question before we get into your story, if that's okay. Don't you feel like though, and maybe not, because I'm not a doctor, but don't you feel like, you know, when doctors have patients and they work up the patient or they diagnose the patient or they're overseeing them like for the majority of their arrival and then they hand them off? I feel like there's got to be an ego thing sometimes. Do you feel that way?
Oh, you can see
where the doctors taking over are kind of like in their head, like not agreeing or, oh, you didn't check this. Firsthand. And so I'm wondering, now that we're talking about this, like in the ICU, if this doctor's worked this patient up, done all of this, and is going down this path, a doctor coming on, do you think that they're ever like, oh, I don't agree with that? Yes. Or maybe they don't, because they missed the whole workup, maybe they just buy into it? I don't know.
I think it goes both ways. I honestly think it depends on the laziness of the doctor coming in. I think that there are some doctors that are like, whatever they said, this is my sign out. So docs get sign out just like nurses do. I don't know that people realize that. Yeah, they get like a little report. And the doctors should have everything tucked in, right? Like typically they don't leave the hospital until all of their patients are kind of tucked in or able to be discharged or admitted or whatever. They kind of want to like seal the envelope with whatever is happening.
Sometimes in the ER, but in the ICU, it's just ongoing care.
Yes. So I think in the ER, we see it where some doctors are like, I don't agree with this. Like something's missing here. This patient still like shouldn't be having pain or whatever. In this instance, this patient's clearly sick if they're vented.
Yeah.
We should be looking at all possibilities. Like, how did this go on for a full month without a singular doctor being like, I'm going to check a little bit more?
Exactly.
Yeah. We went through a medical malpractice case in my family.
I don't think I know this.
My uncle, George, he's still very much alive and doing well. But he was a drug addict my entire life. That's all I knew of him. This is my mom's brother.
I've heard about him.
Kindest human being ever, but we started using when we were very young, and it just continued on. He lived a very rough life. He was homeless a lot of the time, but came in and out. My grandma, being the angel that she is, like he would always come over and she would feed him a hot meal and things like that. But he very much lived a very hard life. And sadly, I lived with my grandma for a lot of the time, and George and I fought a lot because this is also my grandma, and I didn't like that. In my mind, he was kind of using her for things, but this was just his mentality. It was his lifestyle, and there's differences to that. And now being a mom, I'm like, okay, I kind of see, like, of course she's going to help him out when she needs it, or when he needs it, right? He and I had gotten in a fight that day. And I told him to never come back to my grandma's house because I was sick of the shit that he was doing, right? Well, a handful of hours later, we had gotten a phone call and he was at our massive trauma hospital and had gotten hit by a very large, well-known company's truck riding his bike.
On the freeway?
No, on one of the side streets, like out and about. But he was in a crosswalk. But there are so many, learning about this, I can't go into like a ton of the details with it, but there was a case against this. It was the driver's fault that had happened. He worked for a large company. He was on shift, all of the things.
Yeah.
So there was a case that ensued with this. But what I bring this up for is there were so many things that were looked at because of George's lifestyle that played into the amount that was was received. So I think when they look at all of these big cases, they look at what their lifestyle was beforehand, what their jobs were like what was their major sources of income, what was their quality of life beforehand. They have like this whole scale and like huge different like algorithm almost that they use to predict how much money these individuals should be awarded.
Like their life is worth?
Yes.
That's fucked up.
Yeah. It's the craziest thing. So because George at the time was a drug addict, he's now clean and sober. And just to be clear, George spent a month and a half in the ICU intubated. Like we initially got the phone call to come and identify him to essentially say goodbye. But they put his award as essentially next to nothing because he wasn't a productive member to society in their minds.
Wow.
Isn't that crazy?
That's so crazy.
Yeah. So it's interesting to see like these case numbers and how much they differ. So like for me, yes, this pro basketball player that we read about in the very beginning deserves all of the money because they clearly misdiagnosed him.
Yeah.
But he got so much more money than a 10 and 12-year-old little girl. And I always wonder if it's because of his status at the time of his injury.
Yeah, that's a great question that I didn't think about, but it does make you wonder, like, what goes into that number?
It's a lot.
Yeah.
There's a lot that goes into it.
That's wild.
Mm-hmm.
So I do feel like we've discussed this a ton on here. There's like a lot of themes that go into all of these, right?
Yeah.
So like communication breakdown.
Oh, yeah.
Misdiagnosis.
Mm-hmm.
Medication errors. And it makes you wonder too, and we talked about this, is like how many people had to miss these things to get to the mistake or the incident.
Yeah, and
rather.
I think I don't think it's ever an isolated person with any of these. Like there are multiple breakdowns.
I do think certain people probably hold more like liability.
Absolutely.
But like I agree with that. I think it's not just one single person ever.
But I think that this is also why it's so important that when you have anything to do with a patient, that you are documenting that interaction exactly how it goes.
Yeah.
Because you don't have any idea. And like I said in the very beginning, I was simply deposed for putting an IV in that patient. That's it.
Mm-hmm.
And so even with something as simple as that, your documentation needs to be on point because they will come back and ask you everything that you did in the 13 seconds it took to start an IV, but that comes back to you.
Totally. And when we were at NurseCon, actually, we went to that like seminar or whatever about the anatomy of a lawsuit.
That was really
and I
good.
remember him talking about that. Like when you get called in for a deposition, like the do's and don'ts.
Mm-hmm.
And even if you play such a minimal role like you did putting an IV in, they will bring you in, and it's not to try and like catch you in a lie, but sometimes it's try to see what else you know. Because at that point, by the point that you're sitting down with lawyers in a deposition, you've talked to people about this, you've refreshed yourself, like you're up to speed on what's going on. And so they want to see how much more information that they can get from you. And if you do divulge more, then you'll most likely be called back again. So it's like very interesting.
It is. And I think that it's really important for people. I think everybody should go to a class like that or read Jamie's book, like either way, because it is really scary to be in front of people that are asking you questions. And I think what people don't understand too is that there's two sides that are asking you questions. So you have one side that is really kind to you and asking you very nice questions. And then the other side is asking you things like, for instance, with mine, like, would you call yourself good at placing IVs? Like they're very kind of pokey at the things that you do.
That's like a weird
How
question.
many would you say you've placed in your nursing career? And it's like, are you kidding? Like I could never be able to answer that for you. But it's also a tricky question in the sense that if I gave them like, I don't know, 300, they would use that. When in reality, the best thing that you should be saying is, I don't have an answer for you on that. You know what I mean? Because there's no way to answer it.
Did you get any coaching or help before? Because I feel like that's what I would want, like to know how I should or shouldn't answer questions.
So I will say the hospital system that I was working for did bring in their legal team and sat down with me, even just with the small amount that I had to play in that, and coached me through all of the questions, the do's and don'ts, the information that you are okay to give out, and the information that you say, I can't recall. That's like the main thing that you would say with everything. And that was really helpful because I would have gone into it and been like, God, this person's kind of mean. I don't like confrontation. And I would have been like, well, I mean, I guess this many.
Ballpark.
Yeah. And they don't want you to say anything like that. So, but it's scary to be on the other side. And all of these people, I mean, it'd be interesting to see how these like cases really unfolded and how they answered all of these things.
Mm-hmm.
I don't know.
Yeah, that sounds terrible. I really, knock on wood, hope that I'm never involved or named in a,
But also I think another big thing with this, just to close us out, is if you ever feel like something's wrong within the hospital system and you are with a loved one or you are the patient, it is 100% your right and your duty to advocate for anything that you see going on that's wrong.
100%. And sometimes even if you don't know, like I think some people, especially if they have like medical background, like they can advocate for the patient. But if you're like, I don't know anything, but something feels weird, you can ask questions. Like even just saying like, what are you doing? What is that for? Now I work on the surgical side and they're really big about like timeouts and even like simple procedures before surgery. Like if they're going to do a block or something, like it is a very big deal because how many times do people do the wrong site or wrong side or, and it's not always things big like losing a limb, having a limb cut off in surgery. Sometimes it's just like numbing the wrong area. If anything ever sounds like, well, wait a minute, it's my right arm or you know what I mean? Like always ask questions.
I think about it with the basketball player too. And it is absolutely your right. If you are feeling like you just want a head CT, just in like this specific situation, to be like, great. I'm glad that you're thinking it's a sinus infection, but I would really love to get a head CT. Yeah. You have that right. And any kind of different things to be like, hey, I'd really like to just like explore this further. And if it's nothing, cool. You know what I mean? They might talk you out of it or want to, but it's your right to push for whatever it is that you're feeling is necessary at the time. So, this was a good one. It was heavy, but very interesting. These statistics are crazy to me.
Very interesting. I think that, again, like working in healthcare, you always kind of have this like little, I don't know what you call it, like
it's your intuition.
Fear. Well, you have fear of legal stuff over your head. And it's not like every single day that's what I'm thinking about. But every single time I chart a free note, I actually am thinking about how should I say this legally? How is this going to protect me and them legally? And like, it should be that way. And it makes you scared. It makes you really scared.
It's terrifying. I mean, it's terrifying with our profession anyway, to have people's lives in our hands because they legitimately are. But it is scared on the back end too, that your name can come up at any time and whatever you documented is what goes during that time.
Well, and I think one last thing that I want to say is like, we all are responsible for our own licenses. And I think that's the whole point of like, you should carry your own malpractice insurance. But at the end of the day, like if you are working with a physician or a surgeon or anyone who may be doing something wrong or missing something, ultimately there could be a bad outcome for that patient and you may be involved in that care. So it's really, really, really important to document for yourself because it's not your job to protect that surgeon's license. Right. You're on a care team together. You should be having communication. But at the end of the day, it is your job to protect your license and that patient. And so it's super important to document.
Yeah. This was a good one. I hope you guys enjoyed this one. Let us know in the comments if you did. And we'll see you guys next week.
Bye, guys.